Good evening, and thank you for joining us this evening. My name is Shawana Tucker Sims, and as Eastern Area Director of the Links Incorporated, it is my pleasure to welcome you to Taking Control: When Will Black Mothers Matter? This is the latest in our Eastern Area series of Green Table Talks, which are designed to provide real talk with experts and advocates about topics that make a difference to the quality of life in our community. We are pleased to collaborate again with the Eastern region of Jack and Jill of America Incorporated on this topic. Many expressed surprise and dismay when the systemic healthcare inequities in our country became more apparent early in the pandemic, as people of color, especially Black people, suffered disproportionate rates of infection and severity of disease. It should have come as no surprise, however. One of the most blatant examples of the stark healthcare disparities that the Black community suffers in the U.S. reflected in the dismal state of Black maternal health. Black women are 3 to 4 times more likely to experience a pregnancy-related death than white women. Both societal and health system factors contribute to these unacceptably poor maternal health outcomes for Black women. Compared to white women, Black women earn less, are more likely to be uninsured, face greater financial barriers to care, and experience higher rates of many preventable diseases and chronic health conditions such as diabetes. What can be done? That's what tonight's discussion is all about. Our Health and Human Services facet is hosting this program in alignment with the National Pilot Program, LAMS, Links Aiding Mothers to Be Strong. We're looking forward to hearing from Keely Mosley, IT Product Delivery Lead representing our partner Merck for Mothers, who will share her story with us. And we have a robust discussion with our panel of experts that features Dr. Joya Creer-Perry, founder and president of the National Birth Equity Collaborative, Dr. Laurie Zephyrin, Vice President, Healthcare Delivery System Reform, the Commonwealth Fund, Dr. Marianne Etibet, Executive Director of Merck for Mothers. Welcome to our panelists, and we look forward to listening and learning from you this evening. Link Siobhan.
Thank you so much, Madam Area Director, for joining us tonight and calling us to a charge to advance the health of Black mothers. It is an honor tonight to serve you as your moderator and your mistress of ceremonies as we have an amazing discussion about why Black mothers really matter. For our Link sisters that are on the line, as well as friends and guests of other organizations, we have partners from Jack and Jill and other sororities that have joined us tonight. We want to talk to you a little bit about our Health and Human Services facet, intent to talk about taking control. When will Black mothers matter? Now, we are in alignment with a national pilot program that you heard about called LAMS, Links Aiding Mothers to Be Strong. And in this Green Table Talk, we'll address the systemic healthcare inequities in our country, and our intent is to provide information for our listeners to understand the health, social, and political implications of maternal mortality. You're going to hear stories, you're going to hear personal experiences, but you're also going to hear about what you can do to make a difference. Before we begin, I want to acknowledge if there are any Eastern Area appointed or elected officers or chairs, if you would please let us know in the chat. We want to thank you for joining us tonight. Also, if there are any national elected or appointed chairs or officers, please say so in the chat. We want to also thank you and honor you for joining us tonight. Now, we're about to get into a great discussion. But first, we have some words from a very special guest.
Thank you, everyone. This message is so important for me to share. I share this for the women who are no longer here.
And Keely, give us 1 second, Keely.
Oh, okay. Sorry.
That's okay. The video's playing.
Oops.
Hello, I'm Congresswoman Alma Adams, and I'm honored to represent the 12th District of North Carolina and to be the co-founder and co-chair of the Black Maternal Health Caucus. Thank you to the Eastern area of the Links Incorporated for hosting today's discussion on taking control. When will Black mothers matter at your Green Table Talk? And thank you, Merck. I applaud your company's work in the Charlotte-Mecklenburg community and your commitment to reducing maternal mortality through your Merck for Mothers program. I'm thankful that you're working together to host this important conversation on how to improve health outcomes for all birthing persons, mothers and babies, especially Black mothers and babies who remain the most vulnerable. As we know, in the US, the rate of maternal mortality is now worse than it was 25 years ago. For Black women, the risk of death from pregnancy-related causes is a staggering 3 to 4 times higher than for white women. Research also shows that the cumulative stress of racism and sexism undermine Black women's health, making them more vulnerable to complications that endanger their lives. And on top of that, the significant health disparities that Black mothers and infants already face are further exacerbated by COVID-19. Facing Black maternal health during this coronavirus era is indeed a predicament and only makes this crisis more urgent. Black maternal health is an issue that is deeply personal for me. My focus on Black maternal health began when my daughter survived a complicated pregnancy that almost claimed her life and the life of my grandchild. I knew that when I got to Congress, I had to make Black maternal health a priority. So in 2018, Senator Kamala Harris and I worked with the Black Mamas Matter Alliance to introduce a resolution honoring the first Black Maternal Health Week and a bill called the Maternal Care Act, which would create a $25 million program to fund professional training programs to reduce racial bias among our healthcare professionals. That work led to Congresswoman Underwood and I launching the Black Maternal Health Caucus last year to educate members of Congress on this crisis and to work together to write legislation to address it. And with the support of our incredible stakeholders, Representative Underwood, Senator Harris, and I introduced the Black Maternal Health Omnibus Act of 2020, a package of 9 bills that build upon existing legislation to comprehensively address the maternal health crisis. The omnibus makes investments in social determinants of health, community-based organizations, the growth and diversification of perinatal workforce, data collection and quality measures, digital tools like telehealth, and innovative payment models. Additionally, the omnibus places specific focus on high-risk populations, including veterans, incarcerated individuals, and Native Americans. I also want to take a moment to speak about the bill that I'm leading within the package, the Kira Johnson Act. On April 12, 2016, Kira, an entrepreneur, world traveler, checked into a hospital with her husband, Charles, to give birth to their second child, Langston. Despite being in excellent health, Kira did not make it out alive. She died from hours of neglect and severe hemorrhaging, nearly 12 hours after safely delivering her second son. The Kira Johnson Act would make investments in community-based organizations that are leading the charge in improving Black maternal health outcomes. This bill centers on accountability and empowering those community health partners who've been providing safe and culturally competent care to Black moms for years. The Kira Johnson Act and the entire omnibus package would ensure our health care system, providers, regulators, lawmakers, and society finally make Black maternal and infant health what it deserves to be, a top priority. I look forward to continuing to work side by side with experts and advocates to draft and pass legislation to improve maternal and infant health in our country. Let's not leave a mother, birth person, or baby to this crisis. Thank you again for allowing me to join today.
Thank you so much to Congresswoman Adams. And now I'd like to turn it over to Link Supervisor.
Thank you, Leek Shawana. Thank you, Leek Siobhan. I would also like to say welcome to everyone this evening, and it is my pleasure to introduce to you Keely Mosley. She is a seasoned IT professional with over 15 years of experience in software development. She is a happy wife, an amazing mother of 3 children, and a survivor of maternal sepsis and necrotizing fasciitis, which is a very, very detrimental disease process. She is on a mission to share her story about how to fight against the postpartum infections and threats that plague each mother-to-be, particularly those who are African Americans. One of her main goals is to raise awareness for other women and to help them have a safe pregnancy and deliveries by advocating for themselves during delivery and during their pregnancy. Her primary points of focus will be on patient support, patient advocacy, timely interventions, revised workforces, and neonatal intensive care stays. She is developing a patient guide with educational materials and support structures. Please help me in welcoming Keely Mosley tonight. Keely, thank you for joining us.
Thank you. Welcome, everyone. This message that I want to share with you is so important. It's so important for me to share for all the ones who are no longer here with us anymore, and for all of you on this call. Let me say that I am a Black woman. I am educated. I was at the peak of my career, and I had just started a new job, healthy. I had private good insurance. I had 2 children already that I have given birth to. I received prenatal care, and I had the best and very well-known doctor in my city. Sadly, none of that mattered. I went in for a checkup. The doctor checked my cervix. He found that I had dilated. My cervix was leaking. My sac was leaking. I was told that I had PROM, which is preterm premature rupture of membranes and incompetent cervix at 21 weeks pregnant. I was sent home that day to await the death of my baby, but instead I came back the next day determined to see another doctor that can help. Instead, I was admitted on bed rest, and I made it beyond what the doctors had diagnosed it to be. I made it to 23 weeks, and on that day, I had an emergency C-section. I gave birth to a micro-preemie that weighed exactly 1 pound. He thrived in a NICU for 5 months. If having a baby at 5 months early wasn't enough, on the day of my discharge, I was in a lot of pain. I couldn't walk, and I was told it was normal because I had just had a C-section. I accepted it that day because I thought I was a little older than I was with the other 2, and maybe a little heavier, and that was expected. But the next day, things got worse. I was in the hospital visiting the baby for the NICU. I declined throughout the day. I eventually took my temperature in the NICU and determined I had a temperature. My husband wheeled me to the ER. Long story short, I was readmitted. After 2 days, in the very late evening, I was complaining to my nurse. I had threw up that evening. I had told the doctor that my stomach was growing hotter. It was red, hard to touch. And he told me that it was my pajama pants that was irritating me. So I took those pajama pants off. They treated me with Benadryl that night. Instead of sleeping, I stayed up taking selfies. And I found black blisters on my belly near my incision. I told the nurse, please come check. I wanted to show you something. She came, she didn't know. She called the charge nurse, she came, they didn't know. They left and came back with the doctor. That night, I woke up, after I went into OR surgery, I woke up in ICU. I couldn't talk, I had a tube down my throat. My kidneys were failing. I had to have multiple blood transfusions. I was told I had a flesh-eating bacteria called necrotizing fasciitis. I also had sepsis. I was literally dying. And at that moment, I just couldn't understand how giving birth turned into me almost losing my life. So I say, after having multiple surgeries, after fighting, after questioning, standing up for myself. Had I not been so adamant that night, I wouldn't have woke up. So I say that to all you guys, to be empowered, to be vulnerable, to share your stories of power, and to be attentive when you're someone else you know.
The last time I made it, I don't think you ate it.
Thank you.
Thank you so much, Keely, for sharing your story. And as we are thankful that you survived, we're also even more grateful that you shared your story with our audience, because your story will allow us to be advocates. And so as we continue moving forward, I'd like to introduce you all, as everyone can mute their lines. We know we have meetings in the evening, so if you can mute your lines for the little ones in the background that we love to hear play. We're excited to transition now to our panel. And I want to introduce someone very special to me, who is my partner in crime, Link Jill Busey Harris. She's not only the Eastern Area HHS Facet co-chair, but she is also tonight going to be introducing our panelists. Link Jill?
Good evening. We have three powerful, extraordinary women presenting for you tonight. So get ready for a wealth of knowledge coming your way. Dr. Joya Adele Creer-Perry is known as a thought leader around racism as a root cause of health inequities. She is the founder and president of the National Birth Equity Collaborative and the celebrated recipient of the Congressional Black Caucus Healthcare Heroes Award. Dr. Creer-Perry completed her medical degree at Louisiana State University and her residency in obstetrics and gynecology at Tulane University School of Medicine. She is a fellow of the American College of Obstetrics and Gynecology. Dr. Mary Ann Atiabetz has 2 decades of experience improving healthcare outcomes for vulnerable populations and transforming healthcare delivery on the front lines. She is the lead and executive director of Merck for Mothers, a $500 million global health initiative that has helped create a world where no woman has to die giving life. Since 2011, Merck for Mothers programs and partnerships have resulted in healthy pregnancies and safe deliveries for over 11 million women in 48 countries. Dr. Atiabetz earned her MD and MBA from Yale University. Dr. Lori Zephyrin is Vice President of Healthcare Delivery System Reform at the Commonwealth Fund. She has extensive experience leading the vision, design, and delivery of innovative healthcare models across national health systems. Dr. Zephyrin earned her MD from the New York University School of Medicine, MBA and MPH from Johns Hopkins University. She is a board-certified obstetrician and gynecologist and completed her residency training at Harvard's Integrated Residency Program. Doctors, you are our ancestors' dream. Thank you once again for joining us this evening. We will be hearing from each of you momentarily.
Thank you so much, Link Jill, and we are excited to have this conversation. I'm going to start with someone who I know very well, Dr. Joya Creer-Perry, who's wearing my favorite shirt tonight, to stand with Black women. That's why we are on this call tonight. So Dr. Joya, you're going to get us started. We have some really specific questions because you have been not only a leader in medicine, but also a leader in activism. Mm-hmm. And I really want to start with this conversation around Black mothers. So talk to us about the reality. We've heard Keely's story. We heard from Congresswoman Adams, but you are on the front line. Tell us the lay of the lands for Black women that are dealing with issues around maternal health.
Yeah, thank you so much. And thank you to all of you for inviting me and for having this panel. It's so important. I'm excited to be a part of the Link family, and thank you to all of you for tonight. So for Black birthing people, for Black mothers, it's been a real challenge. We're not seen and valued, no matter our income or education. We have seen that despite having degrees, fancy, that we mentioned, all of us have fancy MDs and went to fancy schools, and yet we have data that supports that despite those things, we're more likely to die in childbirth or within 1 year of having a baby than our white counterparts who have no, even a high school education. Right? That the protective nature of whiteness is even stronger than all of the things that we do to protect ourselves through making sure that we have wealth and we have education and we ensure that our families have resources. And yet we know that when people see you and they don't value you, you are not listened to. So your pain is not treated well. If you have hypertension, they say, well, all Black folks have high blood pressure. We have studies that show that we're less likely, even when our blood pressure is high, to get our blood pressure treated after having a baby. And so really understanding that if we still believe in a biological basis of race, because we know that race is not biology, there's no Black gene, although all of us sitting here are amazing Black women, there's nothing innately about our Blackness that makes us have high blood pressure. It's not that we are doing anything, that we have bad choices and we're not showing up. We're doing all those things, and yet we're still more likely to die. So that's why it's important for us to continue to advocate and fight to end racism. And that's not to say to stop people from being mean to us. Racism is not just this, people are saying bad words or people are mean-spirited or they're not good people. There is a structural, a historical, and current belief of a hierarchy of human value that's global anti-Blackness that harms and devalues people. And when you have that belief, you put it in policy and you also put it in practice. So you create systems and structures that extract wealth from communities, that extract the joy and the justice that we all deserve for our children and for ourselves so that we can thrive. So it's an opportunity for us right now to really hold accountable that when we say racism, we don't mean that someone's just being mean to us. We mean that you are creating policies and a system and a structure that is harmful and deadly and killing all of us.
So let's stay here because I think a lot of us that are on the line, just to give us context, so for those that are members of the Links or those that are friends of the Links on the line, some are saying, well, why are we talking about this, right? Are you in your childbearing age or not? Some of us still are, some of us are grandparents on the line, and some of us are really trying to figure out, why would we even have this discussion? And I really want you to give us context because, and we can say this as members of this organization, we are connected to so many women.
Right.
Many of our members are members of other organizations.
Right.
We're partnering also with Jack and Jill. Joy and I are Jack and Jill moms. We have some associate moms that are on the line. And why is it important for us, whether we are childbearing or not, to have this conversation?
Right, because we recognize that a few things. One is we didn't learn this. I can say that I didn't learn this when I was in medical school or residency. This is not something that we knew, that we really didn't know, that all these amazing people who are in Jack and Jill or in sororities, that we thought we were fighting really hard, and as long as we did the survival of the fittest and went to school and did our good jobs, that we would be fine. And the truth is that's just not adequate, right? So although we might do volunteerism, working in communities, supporting people who are less fortunate than we are to be members of these amazing organizations, the truth is we are at our risk. Our bodies, the members of this organization who are probably, we are doing relatively well. We are all in general doing pretty well, but yet despite that, we are still more likely to die. So we need to make sure that our younger members, that our sisters, that our cousins, that our friends know that just because we have achieved some type of social status, and when it comes to having wealth or having resource, that doesn't protect us totally from the racism that's tracking us, and that we're still more likely to die. So it's one of those moments that we don't have the perfect victim, right? Like a lot of times when it comes to things inside of racial justice, we're looking for that perfect person that people will have empathy for, that we can fight around and ensure, like Keely, I love Keely. Keely's story shows you that we don't need to only focus on just looking for people who have been marginalized or people who have not had resource. Here she is having a good job, having access, fighting for herself and still almost dying. So we need to be aware of that so that we can support our friends, our family members, so we can make and share this information, because we want to ensure that they feel safe when they go, that they know they have a partner with them, a family member, that we should have programs within the links, really, to make sure that people are supportive of their link sisters. They know, we check on them. People have babies, and we don't, after the baby comes, what are we doing to support them? Because people are dying up to a year later. So what are the things that we're doing to ensure, because we know this, that people are likely to die, that we're supporting them even despite socioeconomic status? And I think that's honestly one of the hardest things for my fellow, I would say, bougie Black folks to really absorb, Jack and Jill, sorority, all that there's no protection from those organizations that keeps you unless we support each other. The protection is us, our communities. We have to connect to each other and say, we're going to fight this together. We're going to work together, because white supremacy culture does not want us to do that. So we have to fight together to ensure that we get to thrive.
And that connection is so important, this idea of the us is we, right? So we have to take ownership as sisters and, quite frankly, as advocates. Now, I'm going to ask you one more question before I turn this over to Dr. Etiebet. Black Mamas Matter, the Alliance.
Yes.
Tell us about Black Mamas Matter.
Yeah.
That's where we got the title of this from. So we wanted to get some context here.
Yeah, so it's about 3 years old, and we've done a lot in a short amount of time. 4 years ago, I was invited to the Mother House in Atlanta, which is the home of Sister Song, where Amnesty International had done a report around the fact that the U.S. is the only industrialized nation where more women are dying in childbirth. Every other rich nation, the numbers of women dying in childbirth keeps going down. We're the only one that it's going up. And then that Black women are dying at 3 to 4 times the rate of their white counterparts, as was already mentioned. In fact, in some places like New York City, it's 8 to 12 times the rate, right? So we came together, and there were advocates there. There were people who are researchers from fancy places like UCSF and Harvard. There were people there from who were in journalism, ProPublica. There were nurses, there were doctors, there were doulas, there were midwives, and there was about 30 of us there, really saying, well, what are we going to do? We know every time that there's a conversation around anything with Blackness, right? What's the first thing that the people do? They blame us and they shame us. We knew that we had to get ahead of that. We had to get ahead of this narrative that the reason that Black women were dying in childbirth is because we're just so fat and we don't listen. We're so non-compliant and we have all these pre-existing illnesses. And so we knew that we needed to get ahead of that. And so with some help from people like Dr. Etiebet and others, we were able to get disaggregated data so we could debunk those myths, those biases that people show up with, those ideas, the assumptions that no matter that the reason that we're dying is because we are making bad choices or that we have bad genetics. That was all that myth. We had to do a lot of myth busting. So we spent a lot of time really creating research, policy, advocacy, and then doing things like this, sharing this information with sisters, with everybody, with the media, to ensure that we get ahead of this conversation. And that led to many things, like Congresswoman Adams mentioned, the declaration. We had our first a Hill briefing back in 2016. And I love my sister, Cherise Scott from Sister Reach. She said, in the halls of Congress, we're in the people's house, and America was built on the wombs of Black women, right? So this knowing and understanding that even after the transatlantic slave trade, Black women were the economic engine of the country because there was still slavery. And so the creation of my field of obstetrics and gynecology was built in that moment. So that undergirding of devaluing and thinking of Black women as someone to be used for production shows up today when we think about who is the essential workers. And so that's something that really ties into how people see us, no matter our income or education, when we come to a hospital or a space, because they still see us as the person who's there to serve them and not to be served and valued and seen. So that's really the birthing of the Black Mamas Matter Alliance, to change that narrative, to say we deserve all the justice and joy. We deserve to be seen. We're part of the reproductive justice movement that believes in personal bodily autonomy, the ability to have children, not have children, and then this is a big one, to raise our children in safe and sustainable communities. And as we know, with the murders of George Floyd and Breonna Taylor, that safety is so key, right? We know that our children, I as a Black mother, we worried about our children playing outside with a toy gun, right? No matter our income or education, we worry about our children being seen as too old, even when they're young. We worry about them seen as being able to be free. And so if we don't change those systems It doesn't matter what we do inside of getting more technology or more apps or more access to some smart app thing. Really, the valuing of Blackness, the valuing of Black women is at the core of why we have a poor maternal health outcomes in this United States of America.
Thank you so much, Dr. Joy. I'm going to turn this over to Dr. Etsia Bett. Joya gave us a masterclass on systemic racism. It is unbelievable to think about all of the true trauma that comes with not only being Black in America, but being a Black woman, Black mother, and considering the history of Black women's bodies in this country. Dr. Etsia Bett, you are the global lead for Merck for Mothers, our partner tonight, which we are so excited to be in partnership with you on this conversation. Could you help us understand why Merck made this kind of investment in the Merck for Mothers program? Talk to our listeners about what you're doing and really what is fueling and your motivation towards advancing this work.
Thank you so much, Siobhan, and it's so great to be in this circle of such powerful women. And also want to say, Joa gave me a masterclass in systemic racism and how that affects maternal mortality, and it's really informed, how Merck for Mothers has evolved over the years. So you asked the question, why did Merck made this huge commitment? And this was back in 2011, which I can at least attest, and I'm sure it's been a similar experience for so many of us, that this issue was not in the news. That this was not an issue that many people knew much about. There wasn't much data, and our company made the commitment. And Terry is somewhere in the audience, and she may have things to add around this, but it really is that history of Merck wanting to be able to show and manifest its commitment to social values. At that time, Merck was actually going through a merger, and the leadership wanted to create an initiative that could reflect social values of the two companies coming together, and that also would allow employees to work on this issue, bring their expertise, bring their volunteerism. And that's how Merck for Mothers was born. Keely talked about no woman should have to die while giving life. That is our vision, that is our mission. We were started as a global initiative, and as we're learning today, what's local is global, what's global it's local. And the disparities that we see across the world, I'm speaking in from Brooklyn right now, we're seeing, right in our backyards, right in our communities. And then the other thing that's just so special about Keely and knowing Keely is it also happens in the house, in the Merck house. We are a company of about 65,000 people, and this issue affects so many of us in the company. And it's actually been a privilege that many women have been able to share their stories, and actually men as well, sharing stories about their wives or their mothers or their sisters. And for us to be able to do this work, I always say, is a privilege. I think we need to be intentional about it. If we are not putting health equity front and center, we actually run the risk, and we've seen it happen, of exacerbating those disparities. And so the work that we're doing right now in the US really is about how can we close that disparity gap that we see with Black mothers dying 3 to 4 times more likely than white women. And as Joya said, in New York City, it's 8 to 12 times more likely.
We're almost at 200 participants. I'm so excited. There are more people logging in to actually hear this conversation. And we have listeners that are calling in from the entire Eastern Seaboard. So our Eastern area goes from New England all the way down to Virginia. Marianne, I'm going to ask you this question because you are the global lead. So do you find that these same issues that we find in the United States, particularly for Black women, African-American women, does it mirror Black women in the diaspora in terms of the experience?
Yeah, and I'll give you, a personal, personal example there. My family actually hails from Nigeria, as does my husband's family. My sister-in-law, came to the U.S., came to Brooklyn, and unfortunately died in a Brooklyn hospital giving birth. They felt that they were actually, coming from a country with poor resources where, they were hoping to come to another country where they would have high medical care. But
Right.
those societal inequities follow you anywhere you go. I always say maternal mortality is not just a vital sign of the health system, it's a vital sign of our society. So whenever there's inequity, whether it's gender inequity, whether it's racial inequity, whether it's economic inequity, you see the maternal mortality rates follow, and the solutions, are similar. It's about giving voice to women, making sure that they understand their rights and have those rights, making sure that they have access to quality of care, making sure that they are listened to and they are heard and they are respected and their needs and wants are responded to. Those are the things that we just, whether you're in Lagos, Nigeria, and Brooklyn, Brooklyn, New York, if we listen to our mothers and we value what they're saying, we will save lives wherever it is.
Marianne, you said something that was crucial. Maternal health is a vital sign of our society. And that brings me to health equity, because I think many of us are in public health, we're in healthcare. So we use terms loosely. To all of our audience that has no idea how this equity things work, we're not talking about equity as it relates to your home equity, right? This is health equity, which is something a little bit different. Marianne, could you give us some context on what health equity is as it relates to maternal health? And then I also want to close out with asking you too a little bit about where your programs are, so that our listeners can know what's actually happened before we move over to Dr. Lori.
Great. So actually, Joya is the right person to ask this question, but Joya, let me know if I pass the exam or not. But it comes back to that point where we were talking that our degrees don't make us immune to this. I'll give another personal example. I studied to be a resident in a New York City hospital, and I actually gave birth to my first child while I was a resident in the same hospital that I was training in. And there something happened. My husband was very upset. He expressed his upsetness, to the medical staff. There were words, and I wasn't treated respectfully. Neither was he. And it was only until I let them know that I was a trainee in that hospital, then their behavior changed. And I think that, kind of illustrates that notion of equality and equity. You could make the case that I was coming into that situation on equal footing, educated, informed from the medical profession, but the outcome wasn't equitable because of racism, systemic racism.
Yeah, now you did a great job,
She
Mary.
did do a great job, Joya. I'm thinking
I was taught well.
It was excellent. And just contextually, for those that are listening, we in health equity talk about this, removing those obstacles and barriers to what we call optimal health. Now, we fight about this in our field because optimal health means something different for a lot of different people. What is optimal for some is not optimal for others. And so understanding what the standard is for health in America has always been around white health. And to me, that's the biggest oxymoron, because white Americans are also physically sick. We are a sick country, right? So we're trying to compare sick versus sick. And so, Marianne, you did a great job of giving us context for that. Can you let our listeners know where your programs are so that our Link sisters and those that are in other organizations, as Roby comes in and says, hey, we got
Of
the kids
course.
in the back.
And we're excited, we're so excited to be able to support and collaborate with hundreds of different organizations. But there are three things I want to talk about today to the listeners. So one is our Safer Childbirth Cities initiative. And we launched this about a year and a half ago, especially to focus on city-based, community-based coalitions that could pull together the strengths within communities and create that support network for women going through pregnancy, linking them to services. It's in 10 cities, most of them actually across the Eastern Seaboard. If you go to the website saferchildbirthcities.org, you'll see the list of those cities and learn more about those programs. Another website to go to is cdc.gov/hearher. This is another collaboration we have with the CDC, and it's really speaks to Keely's experience in that being able to provide the right information to women who are going through this and may have complications, may have side effects, but may not know the meaning of them or how risky they may be. These are resources that identify, these high-risk signs and symptoms and tell you what to do to them, how to talk about them to the healthcare team. And it's really about hearing her and being able to share what you're feeling, trust that you know your body the best and you can communicate about your body. So you can go to that site, hear stories, you can share your stories. There are resources if you can give to your sister, your niece, share with them these tools that actually have saved lives. And then the last partnership I'd like to share is another one called Mama's Voices. And I think this really leads into what Lori is going to be talking about, which is the importance of policy, but also the importance that our voices inform policy. And so how can we become not just advocates for ourselves or advocates for our families and our communities, but also advocates for policy change. And by, being able to better tell our stories, better identify solutions and have them inform policy, we can make a difference for our daughters and our granddaughters.
Man, thank you. And Lori, I'm so excited to come to you to talk about this because we've been given the setup for this conversation, which is we're understanding what's happening and actually why it's happening. But the question is now, how do we transition into solutions? So we've heard a lot tonight. And Lori, you are, first of all, it's probably one of the best panels that we've ever seen in this space. We have three amazing experts. But Lori, I really want to dig into this policy discussion because we've heard Congresswoman Adams, we've heard context around really the kinds of policies that are needed. But in your work, what policies do you see currently in place or that need to be in place in order for us to really begin to make traction on the improvement of Black maternal health in this country?
First, I want to say thank you for having this panel. It's just really, I always love talking to Joya and talking to you and Javon, Joe, Sheree. Thank you for bringing us together because it's really important to have this conversation. So when I think of policy, I think of how can we impact systems and structures. If you hear from Joya and Mary Ann, it's really about changing the systems and structures. And policies have the ability to create incentives or create accountability and to create change, really, and to help eliminate the racial gaps that we're seeing. I mean, when we think about maternal mortality, I mean, the disparities have been around for 100+ years. If you look at 100+ years of data, we still see these same disparities, disparities between Black people and white people and birth outcomes. And so it's really important to create systems of accountability so that as that trickles down to the healthcare delivery systems and to the communities, that can translate into better outcomes. And so one is, when we think about the causes of maternal mortality, it was just so powerful to hear Keely's story, to hear about just the challenges that people experience after birth, right? And about when we think about mortality, about half plus of deaths and of illness and conditions relating to birth can occur after delivery. So most people think, it's the birthing process, which also has its challenges towards the prenatal process. But we can't forget the postpartum process as well. And so when we're thinking about policies that focus in on how can we ensure that women are receiving the care that they need postpartum is really important. What are the models that need to be encouraged and designed to really ensure that we're providing that care to birthing people from beyond, from delivery and beyond? That's really critical. Whether that's, fourth trimester model of care, whether that's creating incentives for delivery systems to be able to take care of people during that birthing process, that's really critical as well. The other piece I'd like to say is, we know the models that work. We know there's a lot of research and study just showing what works. We need to create the incentives and accountability for people to implement. So whether it's birthing centers, whether it's more midwifery care, Joya and Marianne sort of alluded to the global context as well. I mean, our maternal health system in this country doesn't work for women, period. And it certainly doesn't work for Black women, right? And so if we're improving how we design our maternal health system, we'll improve it for everybody. And if we're intentional about improving it for Black women, meaning we invest in diverse birth workers, we invest in diverse doulas, we invest in Black midwives, we invest in Black-owned birthing centers, we invest in cultures and where health systems actually listen to people when they're saying something is wrong with them. I mean, then we can have a birthing system, a maternal health system that works for everybody. So we have to understand the drivers, like what causes it, and we know what causes maternal mortality and maternal morbidity. We have to think about the policies that make sure that people have access to health insurance and people have access to affordable health insurance. Even though people have good insurance, there's so many people, even with good insurance, have to pay a lot out of pocket for care, and that shouldn't be the case. And so policies around universal health coverage and affordability is critical to really make sure that people can come into the healthcare system before, during, and after pregnancy. And then the policies and incentives can drive systems, can drive insurers, can drive states to invest into models that work. And then I think the last piece is around data and accountability. We have to demand that there's data, both at the federal, state, even at the hospital level, that's publicly available so that we know what's going on. We should be able to look at hospitals and know what the disaggregated data shows. What are their outcomes? How are they tracking them? That is what builds accountability, so that allows us and people to have information so that they know where to go and where to have a safe birth.
There we go. I was having a mute issue there because I was over here doing my hallelujah dance on this policy, because this is what we need. We need to talk about this and this idea of policy systems that invest in those accountable activities and those programs and actual plans that work. So I have a kind of a curveball question, Lori, and I want to think about the Affordable Care Act. We are in the middle of an election season, and we had a Supreme Court judge who is no longer with us. And I'm thinking about the Affordable Care Act, which some have called it Obamacare. I'm very clear it's the Patient and Protection Affordable Care Act. And I want your opinion on this as we talk to our listeners. Has the Affordable Care Act been helpful in advancing maternal health, particularly for Black women? That's curveball that wasn't on the plan, but it just came to me when you said policy systems and investment.
That is top of mind. So let's think about before the Affordable Care Act. Pregnancy was a pre-existing condition. So can you imagine that? So if people became pregnant, they could not be eligible for getting health insurance. So that in itself can impact whether people can have access to care, whether they can afford care. And so the Affordable Care Act is critical. Access to insurance coverage, access to health care is a key piece of of addressing equity, of advancing equity. It's not the only piece. It's sort of the getting access to the health insurance and getting into the healthcare system, and then there's the how the healthcare system treats you when you get there. But the access to coverage piece is absolutely critical. If you think about Medicaid expansion, which was a key provision of the Affordable Care Act, there were states that chose not to expand Medicaid. And so when you look at data that compares states that expanded Medicaid and states that didn't, it's kind of a natural experiment to show that, you know, some of the states that expanded Medicaid, there were decreased disparities in insurance access and in some outcomes as well. And so insurance coverage is a key piece of advancing equity. And you know, and when we think about the other countries that we compare ourselves to, I mean, I think Marianne alluded to this and Joy alluded to this. We are last when we compare to other developed nations when we look at our maternal mortality rate, right? And those countries invest in primary health care for their citizens. They invest in universal health coverage. They invest in health care as a human right. And so when we think about the conversations around universal health care, around the Affordable Care Act, it's very inextricably linked to our maternal mortality discussion. And even, let's say, if we think about insurance coverage or Medicaid, for example, just, you know, if a woman becomes pregnant, she becomes eligible for health insurance. And then 60 days after, she no longer has coverage. What does that say to how we value women as a society and their contribution? Yes. What about the before and the after, and then just the sort of long-term coverage? And you asked a question earlier about, you know, alluding to how does maternal mortality link to the health of a country? I mean, yes. If you think about disparities in cancer rates or disparities in access to care, I mean, if we look across the board, it's all linked. And so we have to really think about it in terms of systems and structure.
So we have some audience questions. You all have been the trifecta tonight. Just for context, if you look in the chat, Dr. Etiebet has given us some resources. So you can go live line and begin to look at some of those resources. But there are two questions. Link Jill, I think we have two questions that have come in. And we're going to go with this first one. There's two for the Merck team. So the first one is, in what way can a links chapter, and I would even offer, because we have Jack and Jill moms on, Jack and Jill chapters assist with the safer childbirth cities? And how does one reach out to their respective city to be supportive?
Great question. And as Siobhan mentioned, I've put the website in the chat, so you'll be able to see not just the cities that this work is happening, but all of the different community-based organizations that are part of those coalitions. And because the range of projects and the range of collaborators are pretty diverse, you know, it's hard to just say there's one thing that you can do, you know, so I encourage all of you to actually go onto the site, explore the organizations, and see, you know, what may be happening in your city and where you may be able to, you know, to connect, because it's quite a diverse range of things that are happening, and we did that purposefully. We wanted to surface work that was already going on, elevate it, you know, support it, and really, you know, be able to benefit, you know, from the diversity of work that's happening on the front lines.
Great. We have another question for you, Dr. Marianne, and the question is, does Merck assist with stipends to educate and train doulas?
So not directly, but through our partners. Again, you know, some of the things that they are doing are actually, you know, some of the policies you heard, you know, you heard described by the Congresswoman in the video earlier. So many of the organizations are training doulas, are training community health workers. So and are supporting, you know, that pathway. So again, I encourage you to look at the specific organizations.
We're coming to the top of the hour. Quick question for you, Dr. Lori. Policy, are there any policy resources? Are there any places that our audience can go to find out more about what they should be looking for, how they can be tracking?
Absolutely. we just launched with the Health and Conservation Task Force a maternal health hub, and that keeps track of not just policies, but also delivery system changes in terms of how to address or improve maternity care, and also creating a learning community of payers and providers and delivery systems to really try to learn together to try to implement things that work to make maternal health better. And so that's one resource as well. For the Commonwealth Fund, we'll also be launching on our site in the next month or so. We'll be launching like a state maternal health map to really be able to highlight what states are doing in terms of policies at the state level that address maternal health. And I think that'll be a great resource as well.
Great. So I want to make sure everyone can hear from the audio that the Commonwealth Fund is putting up a state maternal health map in the coming days, and you see the actual link in the chat. And Dr. Joya, how can our Link Sisters get in touch, get involved in this alliance, in this work? And then we're going to have another special guest before we close.
Great. So the BlackMamasMatterAlliance.org, we have resources on our website, and they're very vast. And we always have Black Maternal Health Week. It'll be our 3rd annual, April 11th through the 17th. It'll be great to have Links and Jack and Jill as partners in the week. It's growing, and we have a lot of activities during the week. And really it's important for us to think about health is not individual behavior, but it's policy. And so the more that we can work with you all as an organization of policymakers, because that's what you are, you can help us to improve and end this racism that's killing us.
To the trifecta of Black maternal mortality and morbidity and Black maternal health, this has been the best panel ever. Dr. Joya, Dr. Marianne, Dr. Laura, you were amazing. Thank you so much. On behalf of Link Jill, Link Sharice, the entire HHS Facet team, we're so grateful to have you share your time with us tonight. Before we close, we have some special parting words from a very special guest.
I have the honor of representing Illinois' 14th Congressional District. I'm excited to be joining you for this important conversation on Black maternal health and the urgent need for comprehensive action to save moms and end racial disparities in outcomes. I'd like to thank the Links Incorporated for hosting today's virtual forum, and I want to give a special shout out to the Eastern Area Chapter for taking on this issue. By now, many of you know the alarming data. The United States has the highest maternal mortality rate in the developed world, and that rate is only rising. For as dire as the situation is overall, it's even worse for Black moms, who are 3 to 4 times more likely to die from pregnancy-related complications as white women, a disparity that exists across education levels, income, and any other demographic characteristic. And behind every single one of these statistics is a story, a mom who's lost her life and left behind a family that will never feel whole again. It was with one of these stories in mind that I joined Congresswoman Alma Adams to establish the Black Maternal Health Caucus in April 2019. Our caucus works to elevate this issue within Congress and advance policy solutions that will address the root causes of the glaring disparities that we see in maternal health outcomes. In March 2020, I introduced the Black Maternal Health Momnibus Act, joined by Representatives Adams, Senator Kamala Harris, and more than 60 members of our caucus. The Momnibus includes 9 bills to comprehensively address every dimension of the Black maternal health crisis in America, from investing in community-based organizations to growing and diversifying the perinatal workforce. And we've already seen meaningful action on the Momnibus legislation. In July, the House Veterans Affairs Committee included my bipartisan bill, the Protecting Moms Who Served Act, in a legislative hearing, the first step in becoming law. The Protecting Moms Who Served Act is an important part of the Momnibus that focuses on preventing maternal mortality and morbidity among women veterans. It's one of many provisions in the Momnibus that's critically important, especially in the midst of the pandemic. COVID-19 has also underscored the urgency of addressing social determinants of health, like housing, nutrition, and transportation. Risks for food insecurity in particular have been worsened by this pandemic. We've seen food lines wrapped around the block, and more than 1 in 6 adults reported food hardship in previous months. The risks are greater for adults with children who have experienced even higher levels of food insecurity. And that's why the nutrition provisions of the Mommy Bus are so important. The Social Determinants for Moms Act, led by Representative Lucy McBath, would make significant investments in federal nutrition programs, ensuring moms and their babies can get the food they need in the midst of this ongoing crisis. Policies like these to directly address health disparities are desperately needed, but we also cannot afford to lose sight of the fundamental issue of healthcare coverage. Next month, the Supreme Court will hear arguments in the Texas versus U.S. case, the Republicans' lawsuit to repeal the Affordable Care Act and rip away healthcare from tens of millions of Americans in the middle of a once-in-a-century pandemic. Dismantling the coverage gains we've made and pre-existing condition protections we've secured under the Affordable Care Act is an existential danger to every American. Right now, we need to be expanding coverage, not eviscerating the protections that millions of our neighbors rely on every day. And that's why I need you to continue your advocacy efforts. Reach out to members of Congress and ask them to co-sponsor the Mommy Bus. Spread the word on social media and continue to host important events like this one. I'm inspired by your commitment to improving maternal health outcomes, and I want to again thank the Links Incorporated for creating opportunities for people to learn about this crisis and take action to save our moms. We cannot do this work without you. Thanks again. Take good care, everybody. Looking forward to seeing you in person again one day soon. Bye-bye.
Thank you so much to Congressman Underwood. We have seen the best of the best tonight. And what you're also seeing is why the links are who we are. We connect with women from all organizations. You've heard the names Lucy McBath. You've heard the names Kamala Harris. Wonder who that is. You've heard the names of Alma Adams and some of the greatest leaders in our country, Black women who are members of the links, who are members of sororities, who are connected for this issue. So tonight, we are so grateful. Before we turn it over to our area director, I'd like to acknowledge who we saw in the chat, the Eastern Area Chair of Services to Youth, Lynn Crystal Davis. It's so great to have you join us, my Scott Hawkins sister. We love you tremendously. And two, all of the Eastern Area HHS Facet Committee that are on, we did it. Great job, Link sisters. We're so excited to have you tonight. On behalf of my co-chair, Link Jill, Link Sharice, who has been leading this work, we want to thank you, Madam Program Director and Madam Area Director. We could not have done this without you. And so we're excited to turn over this closing remarks to our Eastern Area Director, Link Shawana Tucker-Sims.
Thank you, Link Siobhan, and thank you to our dynamic panel for this informative and engaging discussion. A special thanks to our Health and Human Services Committee for putting this much needed program together, led by Link Siobhan Arline Bradley, Chair, Dr. Jill Busey Harris, Co-Chair, Sharice Pfizer, Committee Member, and the HHS Facet. Sharita Lee of Merck, who played a critical role in bringing this expert panel to the green table this evening. As always, a special thanks to our dynamic program coordinator, Rhonda Starks-Crowder, and our technology chair, Aurelia Williams, for their support and assistance. This Green Table Talk has been recorded and will be posted on the Eastern Area website next week. We hope you leave more informed and better equipped to join us in standing strong and letting the world know that Black mothers matter. Have a good evening and thank you.
Thank you.
Woohoo!
Hi. Yes, thank you.
It
Got
was
to do this
good.
again.
Thank you so much. It was amazing. And Link Shawana, there's Link Terry also. She's with the Merck
Yes,
team as
Terry.
well.
Link
So-
Siobhan, you did awesome as always.
Thank you.
Unfortunately, I had two computers, one with video and one with sound. So
Yep.
Great job. Thanks, Keely.
Keely, thank you so much for your story.
So much.
Thank you, ladies.
Take care, everyone.
Ladies, you were awesome. Magnificent.
What a great night. Thank you all. I know it's 9 o'clock. Get some rest. Another great one. Good night, everybody.
Good night.
Good night.
Love you, Jill. Love you, Shawana.
Thank you.
Mwah.
Thank you. Thank you. Thank you, Siobhan.
Thank you.
Wait,